Hello, my name's Sarah Jane Burton. I'm the clinical pharmacy manager here at Jersey General Hospital. Today I'm going to be talking to you about careers in pharmacy. So I've just got a quick video to show you. If we were sort of a live session, I would ask you, what do you guys think that pharmacists do? Often people think that pharmacists are sort of just in dispensaries, they're sticking labels on bottles and things, but there's a much wider range of activities that we do. This video just shows you a quick insight into the variation in job role.
There's a feeling building inside of me. I can't hide it. I need to let it be free. I don't know how you're gonna take to it, but if you understand just a little bit, oh, follow me. Your burning desire, follow me. Set your heart on fire. Follow me. High above, high above.
Okay. So what do pharmacists do? So we're experts in medicines and their uses. We train as scientists and clinicians, and we have a unique set of skills and knowledge. We use this scientific knowledge to advise patients on how best to take their medicines, and we recommend the best medicines for particular conditions and diseases. Some pharmacists are also prescribers, and like doctors, we can prescribe medicines on prescriptions. Pharmacists are the third largest healthcare profession in Great Britain. Although I'm going to be talking to you today about hospital pharmacy and clinical pharmacy in particular, pharmacists work in other settings such as community pharmacies, care homes, GP surgeries, and also in roles with less direct patient contact. So places like universities, regulatory roles, government organisations, research, and also the pharmaceutical industry. So what skills do I need to become a pharmacist? One of the most important things you need is excellent communication skills. We have to translate technical medicines information to patients, as well as be able to talk with consultants, doctors, nurses about things at a sort of scientific level. So you need to be able to tailor your communication style depending on who you're talking to. We often work in busy environments, so we've got to be able to manage multiple tasks. We've got to have to be organised and logical in our approach to this. So if you're working in a really busy hospital dispensary, you might be getting queries from doctors, patients. You've also got to check prescriptions in front of you. You have to be good at prioritising and able to remain calm under pressure. You also need a good eye for detail, and you have to be thorough and accurate in what you do. As I said, we're often the final check for prescriptions before they go out to members of the public. So you need to be able to concentrate for long periods of time and make sure that you don't let sort of mistakes go through. Team working, we work in big teams, so you have to be a good team player, and you need good people skills as well, because we get involved in teaching, whether that's doctors, nurses, peers. So good people skills are really essential as well. So what are the pros and cons of being a pharmacist? Some people might find that certain pros are pros for them, but others might find they're cons. So we'll just sort of go through them all, and then you can decide how you might feel. So one of the pros is job security. So the world will always need pharmacists. We're sort of frontline workers, and we're always needed. So, you know, if you go for a job as a pharmacist, you're always sort of guaranteed to get a role. Having said that, though, it is competitive. So particularly hospital pharmacy is very competitive, and depending on where you want to work, areas are more competitive for hospital pharmacy than they are for community pharmacy, and depending on whereabout you want to practice, it can be quite competitive to get in. Funding and places are limited, especially for hospital pharmacy, so it's best to do work experience and things like that during your summer holidays, and that sort of will help you put you on the best path. Flexible working is another pro for people. So we do work later into the evenings and on weekends, but then that allows you to have the freedom of sort of starting later, finishing earlier, and also job sharing. If you're only on part-time hours, you can often job share with someone else. But then on the flip side, some of the hours are really long, and it can eat into your sort of social life if you are having to work evenings or at the weekends. So again, it's a balance of what people prefer. Another pro is you get a lot of transferable skills with pharmacy. So like I said earlier, communication skills, prioritization skills, teaching, all of those things are transferable, so you can utilize them in other careers if you did want to change, and just in other stages of your life. Variety, there's a lot of variety. We see sort of different patients every day, and each patient has a different story, so you can get a lot of variety within the actual specific job role itself, but also within pharmacy as a whole, so you can sort of move sectors if you want to. As I said, opportunities in new roles and settings. So yeah, you can change between sectors. You can also change between sort of specialisms within pharmacy. So you could be a cardiology specialist pharmacist or a mental health specialist pharmacist. So lots of opportunities to go between different settings, and opportunities to specialize as well. A couple more cons then, it is physically demanding in certain sectors. So if you're working in a community pharmacy, you might be on your feet all day, which can be quite challenging after a long day, and especially if you're working sort of 5 or 6 days a week. Also, it can be a high pressure environment. So as I said, with the prioritization skills, you need to be prepared for things being really busy sometimes, and you just have to stay calm and not let it get the better of you. So what qualifications do you need to become a pharmacist? So you need at least 5 GCSEs. You have to have GCSEs in English, maths, and double science, sorry, and that needs to be at a level C or above. After that, or in addition to that, should I say, you need A levels in chemistry and 2 of either biology, maths, or physics. These need to be an A to B grade. But I would say check entry requirements with any potential universities, because I mean that's often what they specify in their prospectus, but then if you sort of have other attributes you can add to the university, then they might be able to sort of tailor the qualifications you require to get in there. So once you're into university, then we do a 4-year master's degree. At the end of that 4 years, then we need to do an extra year. At the moment, it's called the pre-registration year, but that is actually changing to a foundation year. And once you finish that foundation year, then you have to take final exam at the end, and then you become a qualified pharmacist. So now I'm going to talk a little bit more about hospital pharmacy, and especially hospital pharmacy here in Jersey. So hospital pharmacists are a vital part of the healthcare team. Being a hospital pharmacist means you're a part of a team where the focus is firmly on patients. There's a lot of variety in hospital pharmacy in terms of what you can do. So you can work in the dispensary, in aseptics, and also in clinical. You'll always be working with a large team of pharmacy staff, and that includes pharmacists, pharmacy technicians, pharmacy assistants, as well as clinical teams that include doctors, nurses, and other healthcare professionals. So depending on the size of the hospital, hospital pharmacists can get involved in the manufacturing and development of medicines. So we have a manufacturing unit here at Jersey General Hospital, which I'm going to show you a picture of in a minute. Testing of medicines, so we do take part in a small amount of clinical trials. Supply of medicines for patients, so we do a lot of supply through the dispensary, and also monitoring the effectiveness of the medicines used. So whether that be in clinics or on the wards, we sort of want to check that medicines are actually working for our patients. We provide advice to other healthcare professionals as well as patients, And we are involved in developing treatment protocols for the hospitals so that we can ensure that the gold standard of treatment is practiced. Hospital pharmacists can specialise later on in their career, as I did mention earlier. So you can go into particular conditions, so things like mental health, oncology, which is cancer, or cardiology, which is the heart, or in specialist areas of practice, so things like paediatrics, such as children's health or care of the elderly. Pharmacists also work in urgent and emergency medicines departments, quality assurance, clinical trials, and in medicines information. So there are a lot of opportunities to progress. If you go into hospital pharmacy, you can either progress into management, or if you wanted to go down the more clinical route, you can go into teaching roles, and also working with the wider healthcare team. So hospital pharmacy is divided up into different sections. So these are just some pictures that I've taken of our own hospital pharmacy. So we've got the dispensary. So the dispensary is traditionally where most people think of pharmacists as being. It's responsible for supplying medicines on prescriptions for outpatients. So those are the patients that we see in clinics. Also discharge prescriptions for patients that are on the wards who are waiting to go home. And also we do inpatient supply of medicines for all of the wards in the hospital, and also the external sites, so places like St Saviour's and Sandybrook. Dispensary-based pharmacists are responsible for reviewing prescriptions for clinical appropriateness and prescribed for patients. So checks before the patients receive the correct product. Another area of our hospital pharmacy is the procurement or stores area. So this is an area responsible for procuring medicines and supplying them to the ward so that they can be used as stock. The procurement team liaise with manufacturers in the UK, ensuring that we get medicines that are good value for money. We don't have any pharmacists involved in this area at our hospital in Jersey. However, at larger hospitals in the UK, you'll find specialist pharmacists who are heads of procurement. We also have the aseptics unit, just the pictures here. So the aseptic services unit is responsible for producing aseptically prepared products. So an aseptically prepared product is essentially something that has been made contamination free, so it's free from many bacteria, particles, etc. So what we make in Jersey is adult intravenous nutrition, neonatal, so that's babies, intravenous nutrition, and also chemotherapy. So this allows most patients with cancer to be treated on island rather than having to go to the UK. The unit is run by a specialist pharmacist who ensures the quality and safety of all the medicines manufactured in the unit. Because obviously you can imagine if we're injecting medicines intravenously, if there is any sort of bacteria or contamination in there, we could have some disastrous effects. So hence the need for it to be so highly clean. And lastly, we have clinical services. So this is my area. So we have a clinical pharmacy team, including pharmacists and pharmacy technicians, and we work in a range of specialities and regularly visit the wards. So we meet and talk to patients, and we support the ward nurses, doctors, and also other healthcare professionals with advice about medicines. So at Jersey General Hospital, we have pharmacists specialising in critical care, so that's intensive care traditionally, antimicrobials, palliative care, so that's end of life care, paediatrics, mental health and oncology, and we also have generalist pharmacists working on the medical and surgical wards. Some of us accompany consultants on clinical and teaching ward rounds, so doctors can turn to us for advice before prescribing. And we also get involved in teaching of medical students, junior doctors, student nurses, and we also hold education sessions for members of the public in the community. So that's for patients going through cardiac and pulmonary rehab sessions. So it's quite a variety of things that we do on a day-to-day basis. So just a couple more bits on clinical pharmacy services. So as I said, our team of pharmacists visit the wards daily. We review patient medication for clinical appropriateness and safety. We're supported by a team of specialist technicians, and they carry out detailed medication histories upon patients arriving into hospital. So that's to make sure that when the patient arrives, that all of their medicines are prescribed correctly and exactly how they would take them at home. We counsel patients on any new medicines that prescribed during their stay, and we go through patients' medicines with them on discharge just to make sure that they're familiar with what they're taking. As medicine specialists, we are available to patients and staff as an information service, and we provide advice on dosages of medicines, because you can sort of understand that a dose for a child might be different to a dose for an adult. Routes of administration, so can the patient swallow? If not, then how can we get the medicine into them? What other routes are available? Drug calculation, so we have to calculate doses, especially for children, because often the formulation that we have available might not be able to be given to a child, so we need to do things like dilutions. We have to convert milligrams to micrograms to nanograms, things like that. Drug interactions, so not all medicines can be given together. Some medicines can alter the effects of another one or cause toxicity and things, so we have to be aware of drug interactions and prevent them from happening. Side effects, so we have to be able to recognize side effects, and if a patient does experience a side effect, can this be managed, or should we switch the patient onto something else? And with that, alternative treatment recommendations. So if a patient was allergic to a medicine, then we would advise on what we should give them instead. So I've just got an exercise here just to give you guys a bit of an idea of what clinical pharmacists do on a day-to-day basis. So I would have previously asked for answers to be shouted out, but I'll just go through it slowly, and maybe you can just write down some answers at home. So what we have on the right-hand side of the slide there is something called a news chart, and it's basically a chart detailing different sort of measurements of our patient and sort of how unwell or well they are. So you can see that there's a lot of white in the chart. So white would be normal. When it goes into the green area, that's going a bit worse. Orange is worse again, and then red is an area we really don't want to be in. So I'll just go through this patient's news chart for you. So we start at the top, and we've got respiratory rate. You can see that that's over 21, so, and it's in the orange area, so the respiratory rate's quite high. This patient's got a chest infection, so that's probably what we would expect to see. The next one is their oxygen saturations. So that's in the 94 to 95 area, which is green. It's not as good as white, but it's not as bad as orange. But again, because someone's got a chest infection, we might expect to see their oxygen saturation lower. Their temperature is really high. It's in the orange area. So again, another sign of an infection. Their blood pressure is very low. It's in the red area, which is a real cause for concern. Their heart rate is also high. So that's in the orange area again. And also their level of consciousness here, they're at C, which is conscious, but they are a bit confused. So we're now going to go through the medicines that the patient was taking at home, and then we'll discuss whether those medicines would be good to continue or should they be stopped. So we've got bisoprolol here. So that's a medication that lowers the heart rate. So do you think that the patient should continue on the bisoprolol, or should it be held or stopped? So as we can see from the heart rate, it's already in the orange area, it's already slightly high, so that would be a good one for us to continue. Simvastatin is one that lowers cholesterol. There isn't any reason that the patient can't continue that one, so we would get that prescribed. Lisinopril is a drug that lowers blood pressure. What do you think about that? Do you think they should have that one or not? So you can see on the chart the blood pressure is actually really, really low already. It's in that red area. So that one we would definitely not prescribe on admission, and we'd sort of say, can that be held for now? We need to keep an eye on the patient's blood pressure. Pantoprazole, which protects the stomach from excess acid. There isn't sort of any reason on there that the patient shouldn't have that. Zopiclone is something that aids sleep and it makes you drowsy. So I did say the patient was slightly confused, so that might be a reason for us to hold that one potentially. Salbutamol, which is one for asthma. So they've come in with a chest infection, so we definitely want to get that prescribed for them. And lastly, they've got a penicillin allergy. So we're on the ward round and the doctor wants to prescribe amoxicillin as the treatment for the chest infection, which is sort of the standard thing we would prescribe in this instance. Do you think that's appropriate given the fact that the patient has a penicillin allergy? So penicillin and amoxicillin are in the same treatment class. So if a patient's allergic to penicillin, then we shouldn't give them amoxicillin. And sort of as the pharmacist, we would recommend an alternative. So what next if you want to choose pharmacy at university? So my advice is to make sure you choose the right subjects. And as I said earlier, although they are quite specific, that you definitely do need your chemistry and one other of biology, maths or physics, sometimes universities can be flexible depending on how well you've performed in other areas. Look at the websites of the schools of pharmacy that you're thinking of applying to. Just to get a feel for them, and hopefully when things get back to normal, try and visit those places to make sure that you'd like them. As I said, get some work experience. So I know it's harder at the moment because places aren't really doing placements, but as I said, if things get back to normal soon, then try and get some work experience, or even a Saturday job at a community pharmacy, something like that can look really good on your CV and on your personal statement. I check out the NHS Careers website. Obviously, we're not NHS in Jersey, but that does have some useful fact sheets on sort of careers in different areas, and find out what student life is like. So there's the British Pharmaceutical Students Association, which is BPSA. I'd recommend going on their website because that will give you a sort of a student's insight into what it's like going to different universities. And also, will student life suit you if you sort of want to go down a career in pharmacy, but you're not sure about going to university and you don't think doing a degree is for you, you can look at being a pharmacy technician instead. So I would just sort of do your research and find out which area you want to go into. And that's it from me. Unfortunately, I can't accept any questions, but do feel free to email me if you do have any. I hope this presentation has given you a bit more of an insight into what it's like to go for a career in pharmacy, and I look forward to hopefully working with some of you in the future. Bye.